Welcome back, everybody. I'm glad that you're here as we continue to talk about very important topics to get you ready for the certification exam. For this snapshot, we're going to be focusing on a very important topic, one that I know benefited me as a new faculty member several years ago, and that is the role of mentoring and how it can help support retention as well as recruitment of our nursing faculty. You know, we continue to go through a nursing shortage, and it hits every aspect of healthcare and nursing. And so we need to keep all of our really good faculty like you all as long as we possibly can. There are lots of components related to mentoring that's kind of dispersed throughout the competencies. But for the academic nurse educator, it's going to focus on competency 5. And then for the novice, there are a couple of competencies where you are going to be reviewing content related to self-evaluation and improvement, as well as in the clinical academic or the clinical nurse educator certification. Okay, so this content is relevant for all 3 of the certification exams. It's just a matter of you taking a look at your competencies and reviewing that content to see where it fits to make sure you're closing your gaps. Role socialization, that's what mentoring is all about. How do we get more comfortable in our role as a novice nurse educator? Mentoring certainly plays a role in that. When we think about what the workload expectations are, understanding the norms of the university, of the nursing department, and also where you fit in. As we're looking at opportunities for the next phase of our nursing education journey, it's important to understand the type of university and nursing program you want to be a part of. And mentoring does that for you. Once you make that decision, it helps you transition into that role. All right, it's time for a practice question. You all know how I like to start. Just to get you accustomed to what we call the 3-part question, looking at the STEM and then the situation or circumstance, and then you have a statement before the options are given to you. So being knowledgeable about the content related to the STEM of the question is very important. So let's take a look at this one. So mentoring promotes socialization, role development, and can establish a sense of self-worth for the novice nurse educator. When a new faculty member begins their role, they are placed on the curriculum committee with their mentee to acclimate them to their responsibilities. In order for the new faculty member to be more socialized to their work role, what is the best action for the mentor to take in preparation for that meeting? You see your options here if you want to go ahead and pause the video and come back when you're ready. All right, so if you chose D, to meet with the committee chair and mentee to review the curriculum committee goals and objectives, you are correct. This is going to give the mentee an opportunity to ask questions of the chair of the committee or even to clarify questions they may have. The other options are really related to preparation it could be some preparation before the meeting, looking at minutes, that's certainly helpful. But the best response before the meeting is to have a meeting before the meeting to kind of prep the new faculty member. It also will help decrease their anxiety, right, as they have an opportunity in a smaller setting to ask questions that they may feel embarrassed about asking in a larger group. There are several different responsibilities that the mentor takes in acclimating the new faculty member into their role. First, being considerate of ourselves as the new faculty member, of what our habits are and where our skill sets are as well, specifically as it relates to the topic that we're assigned to teach. Getting to know the academic culture, that means that we should spend time as the mentee, the new faculty member, taking responsibility for introducing ourselves to faculty members. Getting to know the staff. The staff are also very important to connect with as we build a relationship in this new academic climate. We should be guided by change and transition models as we seek new ways to engage in our profession. Understanding the different committees that are in place at the university level and at the nursing level, and taking time to connect with both, right? It's important for us to have a presence at the university level, being engaged with our colleagues across the different schools and the different departments to better understand what their work involves as well. So creating that inclusive culture as we transition into our role as a new faculty member. How am I going to be prepared to teach my courses? How am I going to be introduced to the learning management system that's in place? What type of exam analysis systems do we use? These are all questions that are going to help us better prepare for the role. What is my workload like? How many courses or credit hours am I responsible for teaching in each semester? And does that include summer if it's a 12-month contract? And the scholarship component, am I required to raise a certain percentage of dollars per cycle, whatever that cycle looks like, if it's an annual cycle or a 2-year cycle. So understanding the terms of that contract for yourself is really important. And then the service aspect, because we know we have to be good clinicians, we also have to be good teachers, and we have to be good service workers in our community as well. When we think about our students that are in the clinical setting, they have a lot of say-so and feedback about how our students are performing once they graduate. So that transition of practice period that happens usually in the senior year up into graduation, that's a very important time for our stakeholders, which are healthcare providers and partners, to assess student learning that's happened. Students are often kind of putting the final pieces together and becoming more of an independent practitioner during that transition of practice or that senior practicum. And then once students graduate, we want to solicit that feedback from our healthcare partners about the student performance. That is going to be one component of feedback that will influence our curriculum and our discussions that we have about our nursing program overall. And then finally, looking at the models, there are 2 categories of models when we think about mentoring. There's the formal mentoring process. That can last between 6 to 12 months. It really just depends on which components you want to include in your formal mentoring model. And then we also have the informal, that can last indefinitely. There are certainly mentors that I still have from my academics standpoint that give me feedback about specific circumstances or situations that I'm in, especially when I'm putting together a journal article. I know that I can count on some of my colleagues to give me feedback about that article and make adjustments accordingly so that I have a solid final product. So it can be circumstantial or specific related to what the needs are for that particular faculty member. All right, so hopefully this is giving you more insight about the role of the mentoring program, the benefits of us as new faculty being socialized into the new academic setting, as well as us as experienced nurse educators being able to support and advocate for a solid mentoring program to be in place. It's going to help us retain our more experienced nurse educators and also help recruit our new nurse educators as we continue to focus on creating student-centered learning strategies and teaching strategies in our classroom. All right, so this is how you reach us, and we are excited that you have come back. Make sure you subscribe to this channel if you have not already. Go ahead and review information that we also have in our description section. That's where you're going to find some additional information as well. All right, until next time, this has been Dr. 𝐂𝐮𝐫𝐫𝐢𝐜𝐿, and we appreciate you joining us. Have a great one.